7. You're listening to Radio Doctor on Women Radio WFM 91.7, Nigeria's first and only radio station for women and their families. Today is the 13th day in the month of May 2026, and we are glad and happy to experience this day. It's currently 7 minutes past 10 o'clock right here in the studio. I hope your morning has been going well wherever you are. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise you on Women Radio 91.7. The program airs from 10 a.m., Mondays through Friday, every day on Women Radio 91.7. I'm not here alone, as always. I'm here with awesome men, really, really wonderful men right here with me on Radio Doctor. And I'm just going to allow them introduce themselves. I have Demilade and I have Dr. Ife. Good morning, Demilade. How are you today?
Good morning. I'm fine. Thank you. How are you?
I'm doing well. You're welcome. All right. Today's program is proudly powered by TeleDoc, a secure digital platform that allows you consult verified doctors anytime, anywhere. And with TeleDoc, you can book a quick consult for 10 minutes, or you can also book a full consult that's for 30 minutes. You can choose your preferred time, join a secure video call within the app. You can also upload your medical records and receive prescriptions digitally after your consultation. So it's very easy to use, very simple to use. And of course, you will get valid consultation. And, every Wednesday and Thursday, we feature trusted doctors from the TeleDoc network to answer your health questions live on radio. Just so you know that, yes, we have qualified doctors on the TeleDoc app. My name is Finfolua Akirami, and today's topic is one that many people, may immediately connect together. I mean, not immediately connect together because you are not used to that side of health, and that is stress and oral health. Many times you do not connect stress and oral health together. When people think about stress, we think about headaches, fatigue, anxiety, or maybe high blood pressure. Those are the things that come to mind when we think about stress. But many people do not realize that stress can also affect your teeth. It can affect your teeth, your gums, your jaw, your mouth, and your overall oral hygiene altogether, your overall hygiene habits. And this is very important that we talk about it. Some people grind their teeth without knowing. Some people develop mouth ulcers during stressful periods, and others neglect oral care completely when they are overwhelmed. And these things, over time, stress can quietly contribute to bigger dental problems. I know you didn't know, but today you're going to figure out many things regarding stress and your oral health. I'll let Demilade introduce our doctor for today so we can proceed with the conversation.
Good morning. We'll be discussing the hidden connection between stress and oral health, the warning signs to watch out for, and how people can protect both their mental and oral well-being. So joining us today is Dr. Ifeoluwa Lawal, who will help us understand better how emotional stress can physically affect the mouth and teeth. Doctor, welcome to the show.
Thank you, sir. Good morning.
Good morning, Doctor.
Thank you, Mr. Demilade. Thank you, Ms. Finn.
Thank you so much. The phone lines are open. It will be open shortly for you to ask your questions as regarding stress and oral health. It's 10 minutes past 10 o'clock right here in the studio, and we're going to dive into the conversation. The first question here, I'll let Demilade go on with that so we can, just listen and learn something today.
All right, Doctor. How exactly does stress affect oral health? How does stress show up in the mouth?
Okay, thank you very much for the question. Like we earlier introduced, that many people never attributed stress to having an impact on the oral health. But many of the time, even one of the earliest places to pick that someone is undergoing stress, intense stress, is through the mouth. And one of the very, very classical things that you see, what we call botulism, from what your question is, what are the things that we can see? Botulism, that's what we call teeth grinding, um, uh, dry mouth, when there's a reduction in the saliva in the mouth. There's the major thing also that you guys also may notice when someone is having an oral ulcer, after ulcer here and there around the can be on the lips, it can be on the any it can be on the palate. You can also have gum disease, all these periodontal pockets, periodontal lesions here and there. And also one of the also things that we also see then is classical presentation on habit, appetite change, changes in the habit, change in appetite,
Mm.
dietary change. Because when you're under stress, you tend to snack more. When you're
Yeah.
under stress, you want to take sugary things. So which are also contributory factors. You have dry mouth, your saliva is not producing enough saliva. Your salivary gland rather is not producing enough saliva. You have dry mouth. Then coupled with the fact that you are snacking, taking sugary things, then which subsequently lead to reduction in your immune defense. Immunity is going down, and so those are the major things. Some other things also come in handy, like jaw pain. There can be also body pain, headache, and all of those things, which most people think headache, which is what we always see more. But I'm just trying to also enlighten us to see that okay, also reduction in saliva rate, like you have seen that you are getting your mouth is getting dry. So those are the signs that you can pick from the oral health. From
Mhm.
Mm.
Thank you, doctor. So, in an instance where someone has bad breath, can that be linked to stress rather than hygiene alone?
yes, their link. This thing is a sequel. This thing is a sequel. This led to this. This led to this. This led to this. Uh,
Mm.
our bad breath have a lot of multi factors, contributing factors. Bad breath can be caused by periodontal pocket, just like I listed earlier. I saw a patient yesterday. Oh, the moment the patient opened the mouth, oh my, oh, I knew that. There's, you know, the mouth odor that comes from this door, and it was because of a pocket right there. And the patient that I cannot come. I'm busy. I'm busy. I'm busy. Obviously, all over the person was written stress. So I said, and mommy, you need to calm down a lot of this, just to advocate some other things that the person can be doing. So periodontal pockets can cause halitosis, dry mouth, which causes the rate of clearance in the mouth, food debris there and there. Microorganism is acting on the food debris, so causing food particle to hide in between interdental space between the in the tongue here and there. So there's no clearance. So it can cause halitosis. Um, uh, so oral ulcer too, it can also cause halitosis. So they are not perfect. Someone has hole in the tooth. Those are also causes of halitosis because food particle will be hiding inside those cavities. The person is not, oh, I'm busy, I'm stressed. So you can't really figure out what is the cause of these things. So these are things that are linked together. There is an interplay between them.
Mhm. Thank you, doctor. So, if
You're welcome.
for like mouth ulcer now, can it be caused single-handedly by stress, or there might be some other underlying conditions going on?
Yes, there might be a lot of factors. Even on some planes of mouth ulcer, it is some planes that linked it to the idiopathic, like
Mhm.
no specific cause, it just comes. But when it becomes recurrent, that's when we need to actually pay attention to what could be the cause of this ulcer. When someone is having a recurrent mouth ulcer, this 2 weeks ago it healed, it went away. 2 weeks later it came again. So you might need to actually let the patient know that what is happening. We need to specifically investigate, is it nutritional deficiency? Is
Mm.
it a sign of immunity going down, or the person is immunocompromised? So all of those things, there are things that we have to factor in into. So it's an holistic management. It's not just a I saw ulcer and treating ulcer. No, it's
Yes.
an holistic management. We have to look at the entire patient as in the whole.
Mm.
Mm.
All
Thank you,
right.
doctor. So, at
You're
what
welcome.
point should someone stop assuming that okay, stress and go get checked? At what point does
Well,
do you?
ideally, at least about 3 years ago, 2 years ago, I saw a family, two kids, no three. One, the two of them were twins, and they came for just normal, you know, routine skinning and polishing. And those kids were about 6 years old. Those twins, the other child, which is a male, I think about 8 years old thereabout. And all of them came in just on examining. Then I saw this bruising, the rate at which the teeth are grinded. I'm like, wow. So I have to ask the mother, what's happening? Do you notice this? Ask questions here and there. And then the person said, I'm not aware. I'm not aware. So we have to take a a one-on-one interaction with the mother. Is it going through any emotional stress, any family issue, financial stress that is having impact on the children,
Mm.
which is not having, you are not affected, is not directly targeted to the children, obviously, but the children are actually going through this stress indirectly. So we have to be asking, oh, it's not as if father and mother used to have quarrel that we people don't know about and all of those. So it was all like, it's not where I said. The only thing the woman mother was able to link was that they have been moving from one state to another state in the space of 6 months because the father was transferred for job, so issue of relocation and all. But the level at which the burdensome has happened, it was really bad. So we have, and it was generalized for all the three children. So what I'm trying to say is that you may not, many a times, many people don't even know that they clench their teeth. Many people don't know. You have to ask their partner. They say, no, they will say, even some of them will say, no, I don't do that. I say, okay, yeah, let me, can you call your wife? So it is the wife that now say, you used to do it too.
Mm.
Because it is just something that just happens that your jaw muscle is trying to relax under intense stress. So it's trying to relax, and the only time it's relaxing is when you are asleep. So that musculatory effect, tap tap tap, is happening, and the teeth begin to grind. So you yourself may not know, and that's one of the reasons why we advocate that the checkup, regular checkup, because stress manifests in different ways for different people. It manifests in different ways for different people. So to some people, it might not even be that clenching. It might not be bruising, it might not be drama, it might be something entirely different. Even as simple as nail biting. I've seen some people cope with stress by biting their nails.
Mm.
And it's even research that perfectionists, that's what major thing they do when they are under, this thing is not working, this thing is not working. They just start biting their nails. So this is, we can't really pinpoint that this is the time that you say, let me come to the hospital, let me go to the clinic, that I'm under stress. That's why we advocate that, okay, the regular once in a 6 month dental checkup, and with your possibility of also having your skin and polishing done in those visits. So you get to see those things, and okay, you are told that, mommy or ma, fa, you are having this issue, you need to watch out for it.
Mm, mm. So my final question, doctor, can stress weaken the body's ability to fight infection in the mouth?
Yes, 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 yes. Uh, you know, uh, as we all know, there is under intense stress, the body, the HPA increases hormone called the flight hormone, adrenaline, cortisol. which which tends to increase the heart rate, all of those things, the
Yes.
blood pressure, and which always bring your body into a system of alert. You're always conscious. Mm. That's why you see people that are under intense stress, because there is acute stress, there is chronic stress. They are under intense stress. They sleep, but they don't have deep sleep. So the body to repair, ability of the body to repair itself when you sleep begin to weaken. And because of that, your immunity begins to weaken, one. And the hormone itself, it's the hormone adrenaline, it weaken the immunity because it's putting the body at always this emergency state.
Yes.
The body is always, let's work, let's fight, let's fight. So,
Mm.
so it's stress weakens immunity. And one of the, like I said earlier, one of the very places for we dentists where we see it is around your gum, what we call gingivitis, because there's this inflammation of the gum. It might be very mild, might be very little, but you can obviously see an average Nigerian to understand the state of this
Mm.
country is stressed, is stressed. But when it now goes beyond the normal, that's when so that is what we say acute stress, which is short term, daily, daily, all of us on that. But when it becomes chronic, it's just permanent. It's not getting, it's just permanent, static. The stress is not released, the stress is not getting better. And that's when we say, okay, this is something we need to work towards. So the immunity is weakened, and by the time the immunity is weakened, the body ability to resist certain infection, certain diseases begin to go down, and then it begin to manifest as all these periodontal diseases, mouth ulcers, and all.
Mm. All right. Thank you so much, Doctor, for those answers to the question. If you're just joining us, this is Women Radio 91.7. You're currently listening to Radio Doctor. And today, Dr. Ifoluwa Lawal is shedding light on how stress is related to oral problems, different oral issues, our oral health, how stress can affect your oral health as a person. If this is a conversation you'd like to be a part of, I want you to listen attentively. The phone lines will be open very soon, so you can call in to ask your questions. My question to you, Doctor, would be if stress related issues are ignored, what are the complications that can be developed? You've mentioned a few. I just want you to go over them again. If stress related oral issues are ignored, we don't pay attention to them, what complications can develop?
All right. So thank you for the question. Uh, if I'm going to answer the question as I would like to answer it based on presentation. For
Mm.
example, now we talk about the bruxism. If we say bruxism, that is the teeth grinding. It gets a point that the teeth will grind to a level that almost all the tooth structures will be weared off, and leading to the fact that you begin to have pain.
Mm.
Um, you begin to have pain. It will get to a point that you begin to have jaw
Yeah.
pain, which you have where we can begin to have temporomandibular joints. This the joints that hold the mandible to the temporal bone. You begin to
Yes.
have temporomandibular pain, which which can cause a lot of issues, even far more beyond just teeth, that will lead to even the joint that is around that area. Then oral ulcer, the person will be having difficulty to eat because of the pain, the the pain anytime you are eating a peppery food, all of those things. So the dry mouth also, dry mouth, which can lead to halitosis, like the question earlier that was asked earlier. It can lead
Yes.
to halitosis. It can lead to periodontal diseases.
Mm-hmm.
So there is a multiple of a lot of things because the clearance is low. There's food accumulation, which can subsequently lead to hole formation, which we call caries and cavity in your mouth, within the teeth, subsequently leading to maybe you might need to lose the teeth, which or you might need to go for more advanced treatment if you are if 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 the teeth can be saved. If not, like it presents at a stage that it is far more beyond, it can progress into something else. Osteomyelitis can progress into even necrotizing fasciitis and all of those things.
Yeah.
So it is something that someone has to just look out for. Something that someone like even the bruxism, many people don't know. A lot of people have it. A lot of people have it. A lot of people. So the bruxism, which can lead to the teeth grinding down to the point that it grind to the point that oh the pain is more. There's nothing that can be this. We lose it. We have to take away the tooth and all of those things. So those are the complications. Those are the sequelae of complications that can arise from
Thank you so
stress.
much, doctor.
And not to not talk of the
Okay. Thank you so much,
you're
doctor, for that
welcome, man.
answer. Now, you've spoken a lot about teeth grinding. You've said a lot of things about it. Now, many people grind their teeth unconsciously. It's not that they're not aware, especially in their sleep, during their sleep. A lot of people grind their teeth. Why does this happen and how can we prevent it?
All right. So teeth grinding is well, some people, I've met people that do it voluntarily, and I
Mm-hmm.
also have met people that also do it involuntarily. The the voluntary action, you just have to tell them, say, hello, sir, hello, ma, you need to stop this. This is affecting you. But the involuntary action is due to the fact that your after is the stressor, you have been stressed.
Yes.
The At sleep, the body relaxes. The body relaxes. So the muscles, just like the way when we sleep, you realize that your hand just move involuntarily, your
Mm-hmm.
leg move voluntarily, you turn, your neck move. So the jaw too also moves involuntarily. So, but because there is stress, the stress of all the muscles in the face, the masseter and all of this that hold the mandible to its place, they are stressed. So in the attempt of relieving is jerking, just trying to relieve itself. And just like some people don't know that they sleep talk under intense stress, they sleep talk, they
Mm.
sleepwalk. All those things that contribute, they are those things that are just a they are a factor, or they are a sign of stress. Mhm. So the person just jerk involuntarily. He's not aware, just the way your body, other
Mm-hmm. Yes.
that's just it.
Mm. All right. Thank you so much, doctor, for that. Now, how does chronic stress affect gum disease or gum inflammation over time? How does it affect gum disease?
Okay, thank you. So when you're under intense stress, I said earlier there's active stress, like the one that all of us go through every day.
Yeah.
Like you're talking to me now, you're under stress. Maybe you're stressed, or I don't know. But
Mhm.
uh those ones goes away. You're under traffic, you're in traffic, they quickly go away. You have a deadline to meet. Things it goes. But chronic stress, these are they harm they harm the body physically. So
Mhm.
when you are on intense stress, the body is not given time to itself. The body is not given time to undergo its self recovery. The cells were not able to complete the cycle.
Yeah.
So it comes to a chronic stress. And like I said, there are stressors, a lot of stressors, which are unique to everybody. Emotional stress, physical stress, there is financial stress. There are different stressors that is peculiar to everybody depending on what we are facing. So chronic stress comes in, and then because another thing with chronic stress, there's what we call maybe negligence or ignorance most of the time. Person that is undergoing stress, the least thing that is thinking about is my
Mhm.
even the person that's undergoing chronic stress is not eating well. Diet is not effective, is It's not even, maybe the person even forget to brush, or the person just even forget to pay attention to those simple signs of, okay, I was brushing my teeth, I realized that there was blood as I spit out. So those
Yes.
are signs, oh wow, there's something going on with my gum. There's something going on with my gum. There's blood. Wow. I never knew. Oh. So it is until when you now start calling their attention to that. Yes, is that has been blood here? And I say, yes, so okay. Are signs that you begin to see. Some people they just notice that, oh, anytime I eat, food particle just pack inside one of these my basket. I just I'm fine, I'm okay. So that's fine because that's a sign that's pocket. That's what we call periodontal pocket. So the the body when you're undergoing intense stress, the body release some mediators, some chemical mediators, some hormones are released, those like I explained earlier, hormones. But there are also some factors that are also released under stress, which are said to have effect on the gum tissue, which tends to cause inflammation. One, when it causes inflammation, it leads to periodontal ligament disease, so which causes widening, and all of a sudden the teeth is shaking, you are feeling pain here and there. So it's a sequely. It progresses from this stage to this stage to the next stage to another stage to another stage. So it's a sequence. So it depends on when this person is presenting, when we know how for we to know what stage or what are we addressing at the level of the presentation.
All right. Thank you so much, doctor, for that answer. You've
Thank you.
mentioned that stress can lead to bad breath, dry mouth, and all of that. So, my last question for you would be, why do some people develop mouth ulcers during emotionally stressful periods? Why?
All right. So emotional stress, just like we all know, emotional stress, like the popular Nigerian slang, breakfast.
Yes.
When you chop breakfast, when there's family conflict,
Mm,
when there's a loss of loved one, someone that is those are in those states you are not eating one, or maybe you are not, or maybe you are eating on the food that is eating you. You are not eating. Even when you are eating, you are not taking enough food. You are not taking
yes.
enough water. At those stages, that's when people feed on junks. That's when people feed on carbonated drinks. In those stages, that's when people take alcohol. That's when people take tobacco. That's when people smoke just to take away the stress you get. Just let me forget my sorrow. Let me just get to that stage. It's so those are they are contributory factors that now in the attempt that now leads to reduction in the saliva production
Yes.
within the salivary gland because you are not taking enough fluid. There's nothing you want to say. Carbonated drink is not water.
Mm-hmm.
Alcohol is not water.
Mm,
They are different things. So which lead to reduction in the fluid in the body, which affects the production of saliva. So leading to reduction in salivary flow rate, which causes uh, the the irrigation in the mouth to be reduced, subsequently leading to dryness of the mouth. So what is dryness? What that is because there's a level of wetness that is expected in the mouth. You expected that the mouth is battered with fluid. The oral cavity, the mucosa that is lining it, the tongue, the teeth, they are battered with fluid,
yes.
which is called saliva. So at this point, the person is emotionally down, which is affecting the neural system to 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 stimulate fluid production. One and two, the person is not also compensated for that. He's not taking enough water. He's not even taking food that can lead to stimulation of saliva. So, which will subsequently lead to dryness of the mouth, which will now lead to halitosis. In those periods, now halitosis can be caused by accumulation of plaque and calculus, all those plaque that are there to the tooth, It can be caused by hole in the tooth. There's hole there. Microorganisms and other food debris are inside the hole, subsequently leading to bad breath.
Hmm.
So if there's a consistent, irregular turnout causing flushing, causing irrigation, causing the batting of the dental structure, those things might be reduced, might be limited. So I'm not saying that the only cause of halitosis is dry mouth. There are also other causes of halitosis, but these are also one of the things that causes these major causes of halitosis, dry mouth.
Thank you so much. Demilade, I'll let you take over from here.
All right, doctor. For people experiencing stress-related symptoms but unsure whether they need professional help, how can telemedicine support them early?
Oh, okay. No, telemedicine can support in, I remember those days I have to wait for a long dental appointment, a long visit, all of this. There's no doctor around me. You can always reach out to a dentist. You can always reach out to even, and every one of us, both a general physician and a general dent, dental practitioner, have been trying to identify stress. When you come in, we are not just only looking at you based on uh, by the time you are talking, you are discussing, you are giving me signs of this, signs of that. I begin to say, oh, this is what we need to do. This is what we need to do. So telemedicine has brought medical care home, has brought it to the comfort of wherever you are. And
Yes.
when it's not beyond, okay, this is you can do this, you can do this. We can do this. You can begin to address it even before it progresses to a stage that is beyond
Mm-hmm. Okay. I think we've
talk
lost.
of advanced care. So telemedicine has brought care home.
Mm, that's right. Teledoc
So
allows
you
you.
wanted to say something, sir?
No,
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 no.
no,
Please
doctor,
go
it's all
ahead.
right. Teledoc allows you to speak with verified doctors securely from the comfort of your home, and you can get early guidance before symptoms worsen. You're listening to Radio Doctor on Women Radio WFM 91.7 FM, powered by Teledoc. Teledoc allows you to book at your preferred time. You can join a secure video consultation. You can upload your medical records for the doctor to review, and you can receive prescription digitally. It's healthcare made simple and secure.
All right, the phone lines are now opened. Today on Radio Doctor, we're discussing stress and oral health. What's the eating connection? How do they relate to each other? When you hear stress, many times you cannot connect it with oral health. But today we're letting you know that stress and oral health can be in the same sentence and they do affect each other. That's what we're talking about today on Radio Doctor. If you've experienced maybe pain in your jaw, your teeth is grinding, mouth ulcer, gum problems, or other oral health concerns during stressful periods. Maybe you have too much work to do, or you're going through some emotional trauma and all of that. You can call in now and speak with our guest, Dr. Ifolua Lawal. He is here and ready to answer your questions this morning. The number to call is 09155 917 917 09155 917 917. We'll be ready. We're ready to take your calls. We're ready to hear from you. The phone lines once again is 09155 917 917. Over to you, Demilade.
All right, doctor. How much does poor sleep contribute to stress-related oral problems?
Are you
Doctor,
there,
did you
doctor?
hear my question?
Hmm.
Doctor, can you hear me?
Okay.
Sorry, can you take that again?
Okay. I said, how much does poor sleep contribute to stress-related oral
Yes, actually.
problems?
Hello, hello, can you hear me?
Yes, doctor, we can hear you.
Yes, I can hear you now.
Okay.
Okay, doctor. I said, how much does poor sleep contribute to stress-related oral problems?
Hello, I can hear you now.
All right, doctor. The question
How
was,
much does what?
yes, how much does sleep contribute to stress-related oral problems?
Poor what? Sorry, can you? Poor,
Okay. How much
poor.
does poor sleep contributes to stress-related oral problems?
I can't hear the question. Sorry.
Okay, maybe we should ask another question. But can you hear us clearly, doctor? Okay, I think his network over there is not great at the
Okay,
moment.
poor sleep.
Okay. Yes, poor sleep.
Oh, thank you. Sorry. I wasn't hearing you very well. You
Okay.
know, well, it's it depends. Poor sleep can be categorized based on age. Hello,
I can hear you.
We can hear you, doctor.
hello, hello.
We can hear you, doctor.
Yes, I heard the question now. Hello,
Okay, you
Yes, you
can
can
go
go
ahead.
ahead. You can go ahead.
hello, hello.
You can go ahead, doctor.
Yes, I heard the question now. Can you hear me?
Yes, we can hear you.
Hey,
We can hear you, doctor.
hello,
Dr. Fall, we can hear you clearly.
hello.
Okay. I think his network is not. Dr. Fair, can you hear us? Anyways, this is
Hello.
Radio WFM
Yes,
90.
I can hear you.
You can go ahead with the question.
Hello,
You can go ahead, Dr. Ife.
hello. Can you hear me now?
Yes, we can hear you.
All right. So sorry, I guess it's network. So for sleep, because there are certain things that we need to first categorize it because poor sleep are depending on age. Because one can say, this person is having poor sleep, poor sleep. When you are young, we need to do some work here and there now. You understand? Some of us, an average of us used to maybe 4 hours a day before we sleep. But when you are getting above 40, you need to be having an adequate sleep. You
Hmm.
need at least you need to have 6 to 8 hours every day. So when you are still all those sorry to say, so all those days that they tell you that you need to I only 6 hours a day. When you are young, yes, it's possible. The body still have capacity to quickly repair itself. But as age advances, you will need to start cutting down the the number. You need to increase. Sorry, you need to increase the number of sleeping hours that you're having. And even there is advocates that 7 to 8 hours per day. It's advocated because when your body is under stress, it won't have the ability to repair itself. See, everything about the body is that the body is programmed to repair, to regenerate, to reinitialize itself. So if the repair is not going as it's meant to, so the cells is undergoing breaking down, is finishing a cycle, and the cycle for its regeneration is not completed. So it's going to be showing, it's going to be having effect. So the cortisol is high, the adrenaline is high, everything is just high.
Mm.
So those are the effects of not having proper sleep. So how can it wind down? It's you having time out, not just only, even not just only sleep, because some people sleep, but the sleeps are not deep.
Mm.
It's not sound.
Mm-hmm.
So you say, and I'm sleeping, is because even at that, in your sleep, you are still stressed.
Mm.
Yes, yes, people sleep, but they sleep. And I like, yesterday, you will have people, and I said 8 hours, but when you meet them, you are still stressed. So they need more than just sleep. They need to relax. They need to unwind. They need to do certain things like maybe listening to music, maybe meditation, taking deep breaths regularly. That also has said to contribute to relieving stress, not just only sleep. Because yes, you might some people just need to go and sit down in the bath, turn water on, and just relax.
Mm.
Uh, just relax, just listen. So I think for me, for someone like me, I listen to music. Music relieves me of stress. Some people stretching, jogging, walking, all of those things, they are tend to reduce stress and reduce and also tend to relax the muscles. The tension in the muscles, they are relaxed when you undergo through those activities. So what I'm saying is that it's not just only sleep that contributes to stress, but sleep is important for us in managing of stress.
Mm.
But not just only sleep. Some people sleep, but the sleep are not sound.
Mm.
That's really
Thank
serious.
you, Doctor.
Mm-hmm.
Thank you, Doctor. The last question I'll have for you, Doctor, is can anxiety lead people to neglect their basic oral hygiene, such as brushing, flossing, and things like that?
Yeah. Anxiety is a very big one, as even as we practitioners that we deal with as a practice. Some people are just anxious of a lot of things.
Mm.
Uh, and because of if I brush, I'll bleed. If I brush, I will feel pain. If I do this, this will happen. If I do this, this might do this. So because there is everybody is the people have their prejudice, their bias sometimes that make them to have their anxiety. So some people are just anxious. Even anxiety itself is a stress.
It is. I agree.
So yeah. So some people are just even people are just overwhelmed. They,
Mm-hmm.
ah, two weeks ago I did this. Some things and now you are telling me that this is it. Oh, let me just relax. I'm not going anywhere. All of this. So those they can contribute to you being worried and concerned, and even not just only worried. I've seen people that make anxiety has made them not even to visit the doctor at all, particularly the dentist. Because what an average person carries about dentist is that it's pain. Ah, pain.
Mm.
Ah, so, no, no, it's more than that. So, no, the moment they come, will you pay me? No, no, it's not just, uh, will you pay me? No, no, no.
Yes.
So, the anxiety, and that's why every in those situations, when the person is worried, is anxious, is overwhelmed, we need to first get to the root of it, what it is, and interaction we get to know, okay, this might be the root cause of what this person is having. Because prevention is far better than we doing curative. The prevention, because even you can do cure, but if the person or the individual is not taking proper care of what is meant to proper care of those things, or is not yielding to instruction, is not putting the preventive measure,
Yeah.
he will still come back even in the worst state. So that's why we advocate for getting to know the root cause of most of these presentations.
Wow. Thank you so much, Doctor, for today's conversation. It's important that we have this conversation often, especially because stress is one thing that a lot of Nigerians can relate to. Even if you are just sitting down in a car, you are stressed because the conductor is shouting, somebody has not collected their change, you're stressed already while doing nothing, So this is something that a lot of people need to be aware of in relation to their oral health because it's very, very important as well. To wrap up the conversation this morning, my last question for you would be what practical steps can people take to protect their oral health during stressful periods? We cannot avoid stressful periods 100%. So, what can we do always to protect our oral health during stressful periods?
Okay, thank you much. All right, so like I started earlier, we need to identify the stressors.
Mm.
Ah, some of these stressors cannot be taken away.
Yes.
You see, you are looking for money, all of those things.
Always. Yeah.
They cannot be totally taken away. But you can just control, you can manage how it can get to you. You can manage how it can overwhelm you.
Yeah.
You can manage those things. You can, and one of the things that we're also seeing that works a lot is you having someone to talk to. Many a times we just sit down in clinic and the patient comes just talking and talking. And by the time you are done talking, and I feel relieved. You can obviously see that the person is actually looking for someone to actually talk with, have a chat with. So ask
Yeah.
someone of like mind that you can talk with. And like Mr. Demilade asked earlier, ask but sleep, proper sleep has
Mm.
also contribute to having to relieve stress. Proper sleep, proper sleep. Then doing different techniques of relaxation. Know what works for you. Know how you onboarding, how you unwind,
Fine.
how you release stress. Yes. I have people that say work stays at work
Mm-hmm.
and home issues stays at home.
Of course.
I don't carry home issue home and all of those things. So all of this. Don't let things get too much to you. And then people having time to relax, to maybe walk, have regular walk routine, jogging, stretching yourself. Then for the oral care, because this is an holistic care. For the oral care, one of the things we advocate is that you avoiding coping mechanisms. Many people cope with smoking. Some people cope with taking excessive alcohol. Some people cope with nail biting. They cope. That's
But is that not
their
bad
coping mechanism.
for your oral health as well? Alcohol, smoking.
Yes, that's what I'm saying. That avoid those coping mechanisms. That
Mm.
doesn't say that's how they cope with stress. Mm.
Serious. That's true.
They say this is how I cope. You say you see you see bankers when they are stressed, you see pen in their mouth.
Mm-hmm.
That's also when I see that I just see you are stressed. That's how they cope with stress. They just start biting their nail, all of those
Yeah.
things. It's a sign of stress. So you need to avoid those that some as I said, you have to avoid harmful coping habits. Yes,
Yes.
to some it is I'm relaxing, but it is doing more harm than good.
Yes.
Excessive alcohol, excessive smoking, and all of this. It is doing more harm than good. And for me as a dentist, when you come with those things, you smoke. It has effect on your teeth. It has effect on your oral tissue. It causes those are triggers for oral cancer. Those are triggers for periodontal disease. Those
Mm-hmm.
are triggers for mouth ulcers.
Yes.
Ah, so because it's not doing good for you, it's doing more harm. So then the diet, your healthy diet, reduce excessive sugary things, excess sugary food. Try to feed on fruits because some fruits have also been linked to have stress relieving factors. Uh, one of my friends will say, this food used to reduce endorphins. I say, this food, when I take it, reduce endorphins. That people say feel good hormone, the
Yes.
hormone that make you feel good. Yeah.
Mhm.
So people say, when I take watermelon, I feel good. When I take this, I feel okay. So
Of course.
fruit, you can make those substitutes for yourself. Smoothie. I have people that say, no, just give me smoothie. I'm fine. I love those things. So it helps to reduce helps to manage the effect of those health of those things that you are going through and on the general body too. It will not just only help me as a dentist, it also
Yes.
help the general holistic because for example now you are taking watermelon, it has this coax effect, it helps in
Well,
cleansing. You
okay.
take pineapple, Yes, it helps in cleansing the oral tissues. It cleanses the tongue because you are biting, you are grinding, and all of those things. So it helps in cleansing too, and also helps to stimulate saliva production.
Mm.
So those are
Thank
the things
you
that
so
can be
much.
done.
Yes.
Yeah.
Thank you so much, Doctor. This was such a wholesome conversation, and I'm sure that those listening would have learned one or two things from the conversation. A big thank you to Dr. Ifeoluwa Lawal for today's enlightening discussion on stress and oral health, the hidden connection. And we've learned a lot about it this morning. If you would like to talk to a doctor privately, you can download the TeleDoc app today. You can book a quick 10 minutes consultation or a full 30 minutes session. You can choose your preferred time, upload your medical records, and speak securely through video consultation and also receive prescriptions digitally. Thank you so much for listening today on Radio Doctor. This is Radio Doctor on Women Radio 91.7, Nigeria's first and only radio station for women and their families. And this happens every Monday to Friday by 10 a.m. Join us tomorrow morning for another special edition of Radio Doctor. A big thank you to the producer, Aisha Sunny, and to my executive producer, Tom Okiwale Shonaya. My name is Finfulua Kirami, and I was here with Dimilade.
Okay.
Dimilade would like to say goodbye.
Yes. Have a good day, everyone.
Have a good day, everyone.
Thank
Bye
you,
for now.
Doctor.
Thank you.